Hello, everyone, and welcome back to the Empower podcast. We're here with a returning guest once again. We have RN Tom out of Denver. Hi, Tom.
Hello, how are you today?
Welcome back. I'm way better than I deserve, and I'm thankful to have you back. We've had a number of different returners, and I'm thankful they all have something, it seems, different to say and a different perspective. And I think even if they tried their hardest, they probably couldn't say the same thing. That's just from what I've seen. And again, there's what I know, what I know I don't know, I don't know. And as long as I think I know that, and others know that I know that, and they themselves know that, I think they know a lot. So start off. Podcasts run by healthcare professionals for healthcare professionals, community care, and health and wellness realms at large, not just domestically in the United States, but globally. And we're on various platforms such as Spotify, Apple Podcasts, YouTube. You can go ahead and check us out, follow, like, subscribe, share us. And I want to start off here, if we can, for the big community thank you or acknowledgement. Tom, any individuals or organizations, whether here in the United States or throughout the world, you'd like to acknowledge that make a true difference in your life?
Um, yeah, I just like to give a thanks to anybody working the bedside still. I guess I'm partial or biased, but I still maintain that that's the hardest position in healthcare, and I want, if I could give everybody working the bedside a $5 raise, I would, but I'm a peon myself, but thanks.
Yeah, shout out to those at the bedside. Whether in any shift for that, and hopefully multiple shifts, and even those. If I can add on to this, because I'm just empowered by that. I really am. I have to ask myself: is there a part of the podcast, Brett, where this guest makes you feel empowered? And Tom, you've certainly made me feel empowered. Thank you for that. And for those who are even whether you're listening to this on day shift, night shift, mid shift, on your lunch, even just a portion, I want to add on thanks to you as well. It's truly what makes a difference in our communities at large, and whether you are, and I think I had a past guest said this too, whether you are unseen, unheard, or unacknowledged, here you are important, and we appreciate it and hope you can stay empowered. Thank you for that, Thomas. We're going to go ahead and lean in here and get into, because we had did our question of what, in their opinion, is happening in healthcare and health and wellness. We'll take it here with progress and not perfection, because it is, I feel, one of the toughest nuts to crack, Tom, and still is. So take us away.
Perfection. Yes.
So what would you say is happening? What's going on out there?
In healthcare right now, there's a lot. I guess I want to narrow in on the insurance industry, and I think the early December assassination were the killing, the murder of CEO Brian Thompson. I think as bad as that was, I think that it's brought a very important situation that affects pretty much anyone in the United States. I mean, obviously, if you're very well off and you're very wealthy, these medical bills, that's the thing, that you got to be pretty damn wealthy now because of what it's gotten to. But the insurance industry, from what I can see, has really become sort of a middleman. I talk to coworkers, with chronic medical conditions who they're paying $200 or $300 a month in insurance on their paychecks. And then when they need to go, get an X-ray or, an MRI or this or that, they're still on the hook for, hundreds of, sometimes even, a few $1,000s. And I guess there is just a concerted effort, I think, by these insurance companies. And I think, to deny claims, obviously that's how they retain a profit. And there's no other country in the world that operates on this system. It's uniquely American. Some countries have a government and a where people. Here, there is no real government care. If you're over 65 or you're disabled, you can get some government benefits, but not not like, you know, a good private plan. But a good private plan costs so much now. What it costs for like a family of four is just absolutely insane. Like talking to some of the people I work with, you know, so, you know, a family of four, you know, it's, you know, the insurance is, you know, you're talking $700-800 a month in insurance premiums. And then when it's time to, you know, use the copay or the ER visit or what have you, it's still, there's just very little cushion. I mean, I guess you're saving some money. I'm certainly not here recommending anyone get off insurance or not have health insurance. That's
Absolutely.
not what I'm saying
Correct.
at all.
Correct.
I'm not recommending that. I'm saying that what your plan covers, you need to know, especially what in and out of network. Memorize what's available, you know, in case of emergency, because that people pay into the, you know, their insurance, and then they go in an emergency to a place that's not in their network, and they getting back to Brian Thompson and then Luigi Mangione, the man that shot him.
Yeah.
I think that was the wrong way to protest an evil system, a system that basically profits off of death. I think that, you know, it basically proves, you know, if greed and sort of violence is the only way that we're all going to, you know, hear each other out, then, you know, if society where an eye for an eye is sort of the way that we're going to do things, then, you know, that should make people start talking. Is that the kind of world you want to live in, where your insurance companies are killing you, and then you've got, you know, angry customers? You know, some of these companies, they have to take off. They've removed photographs of their CEOs and their chairmen from the websites because they don't.
In response, you're correct. You're exactly right. This is what is occurring. It's literally what is occurring, and to see that the overall landscape of healthcare is already making a pivot with the integration of AI and all these other areas. So we can only think, you know, and it makes us all wonder as to, okay, well, if that's the way things are now, if we integrate that in, then what is that going to look like for the area of not only health and wellness, but access to healthcare and being able to have it affordable? Yeah, what's up? What's going on?
I'm curious. What are you speaking? Because I know you're I'm not leaning into the tech part of anything in healthcare,
No, you're good.
And I know you are. So let me ask you. What do you think? How do you think it's ethical for an insurance company to use any human being to tell a human being that they can't have care? I don't care what you AI or this. I think I read about
right. So there's not like
anything that's automated.
Yeah. So there's like do I agree with that at this juncture in time? No, I do not. I'll give you that. I really don't. I think it should still be human to human. It shouldn't be even if it's some generated system that sounds like you or I. That is not a connection. That's not care. First of all, and there's points of care that can still occur, and I'll still tell you, and I think this is the point you're touching upon is the billing aspect is still a point of care too. But it seems there's areas in which the insurance companies and healthcare at large, health and wellness too, are leaned in on those points of care, and there's areas where they're leaned out. You know, and when someone's terminal in bed and they can't pay their bills, they're leaned out. And when it's time to collect the bills, they're leaned in, you know? So I get what you're saying, and there's a conversation to be had there, and violence is not the answer. Violence begets violence. And you had mentioned the quote, too, an eye for an eye. I believe there was a quote by Gandhi, too, that was, an eye for an eye only leaves the world blind.
Yep.
So last I checked, I don't want to be blind. Nothing wrong. Yep. If anybody is blind, we love you, and we're so grateful that you make each and every day worth it, and you have your own quality of life. And if it's not promoted, I hope there are systems that you find, and if not, even feel free to email us, and I'd love to discover with you to see that, because even then, those are the areas of life that even the person who still has other disabilities are up against the same paywall or the same price model as well too, and you're up to that. And I want to acknowledge you and admire you, honestly, for knowing at your own pay grade where it is that you're at versus those of your coworkers, and the distinctions between them, and then their own quality and their own access to care too. That's love. If I have to say anything, that's love. I feel the love, and that's wanting to share that information. And I don't know if anybody has looked. POTUS, the most recent president of the United States, POTUS, has issued an executive order now to raise the ability for people to have price transparency. It's one of the executive orders that went out too. And I'm still doing your own research, look into that. And it's to empower the patient to ask those questions when you're in that room, to ask your provider that. And if they say they don't know, there's an executive order now that they're supposed to find. Oh, we don't know anymore. And especially, and then that leads to price transparency and not, okay, well, you don't know, first of all. Then you find out that you know, but then you got to figure out whether it's fair market value, if it fits into their price model. And then you're sitting there waiting at the consumer level. Just had a past guest. I don't know if you've listened to her. She was a returner as well. Julie, she was an ICU nurse. She still is, in my opinion. And she got to discover her journey with healthcare. And that was to get the people who all needed to be on the phone all on the phone. She got the conference call together the way it's supposed to be, had them all literally audit each other and line up the dots, right? Cross the T's and dot the I's and make sure everything is supposed to be where it's at. Now, should the consumer have to be able to do that, Thomas? And they're already paying that premium now. What, are they working for the insurance company now too? Kind of sounds like it. Wow. Or what's the point? You know, if someone's doing the service, it's almost, in my opinion, like the self-checkout. Like, are we the workers then? Cool. Okay, so give me a discount. You know, I've decided to use the self-checkout and save you from not having to have labor that hour, and how many other people that you know in your Excel document that swipe past that cashier machine, because I don't as the consumer, but you do. But you know, each time they're going to ask if you want to buy the bag, too. You want to buy the bag? You want to buy the bag? You're still doing the work, but you want to buy the bag. And it's kind of like, yeah, give me a discount. If I'm doing it this way and it's supporting you technologically, cool. And the other thing I would ask too, and I've noticed these people in the store too, still keep the human. They're the people that will wait in line for the person at checkout, and that is their way. They are set in that. And honestly, if that's their quality of life, whether they're retired and whatnot, and they want to do that, then great. I mean, if that's what's giving them, they're not harming anybody. They're still trying to promote business, whether it's small, medium, or large. So, yeah, wow. So, farming. I did want to touch upon farming in healthcare. I don't know if there's a connection there. I don't want to get off topic too from the overall. We can all float back. The structure is sometimes there's no structure, and I like it. I love it.
Oh, dude, I hate structure.
Yeah, no, I get it. No, I recent discovery. So, but to see all the floating between that and then the farming aspect, because I know recently there was also another area of legislation that was passed by POTUS that is to pretty much monitor and I believe also, in my opinion, eliminate the ability for the Chinese to buy farmland in the United States. So
yes.
is the real thing to keep farming here domestic and allow for those who do live here and do pay the taxes here, not to say that those who aren't coming over here on foreign business too, because there is a part of the tax code where you can get credits if you pay taxes in another country. Again, do your own research on financial stuff here, but there are areas of the tax code that allow for, say, someone of another country to still come here and practice if they do it the correct way. There is a correct way to do it. But to be able to acquire that, because I think it was early 1900s, I had a friend share with me, you know how much an acre of land was in the early 1900s, Tom?
Like $10 or something?
Close, 5, you're right. Literally. Can you imagine that? Just imagine that. But obviously the value of that at that time too, you know. But still, right, to see it that way, and to see that was it, you know. And even then, I'm sure there were still terms and conditions and contracts like there can be in today's world. And I guess that's the only way I can really say on that. So, and that's what people helping people can be, and people wanting to still get to their achieve their goals in whatever way it may be. So, but farming aspects, and I didn't know if there's anything you want to touch upon the world or on farming, because I think we had that as one of the topics last time. If not, either way, we can float on to something else too. So
with farming, I guess really I'd really kind of beating on the glyphosate drum. It's being promoted still too much for farmers, and they're using it not just really as an insecticide or as a pesticide or what have you. They're using it as well as a desiccant to dehydrate the crops once harvested, to promote a faster time from harvest to sale. So they're not only spraying the crops with glyphosate, which for those of you that don't know, glyphosate is the active ingredient in Roundup, but they're not only spraying the crop with that, I mean, they're using it as a desiccant. So even after the plant's dead and hanging up somewhere in a barn, it's being sprayed with Roundup.
Yeah.
So I think for farmers right now, there's never been more of a crisis. Lots of people say that it's not a career, it's a calling, like farming, and I would agree with that. But there's never been more of a crisis in a sector of our economy than agriculture. I mean, just all that's
In
being
U.S.
done
U.S.
right now
farmers too, right? Just U.S. farmers are the ones using glyphosate, or would you say it's being used globally?
It's being used globally, yeah,
Okay.
but it's being used in North America.
Yeah.
Probably like 90% of it's being used in North America. The EU has gone back and forth on banning it. The National Institute for the Research on Cancer has a tremendous amount to say about it. They think that it's highly probably carcinogenic. Is how they is their categorization of I guess they've year 2020 selling Roundup in the United States without glyphosate, but there's still so many. There's literally, I think, hundreds of thousands of pending trials. Like there's this litigation that's ongoing with this company.
Right.
But anyway, it's owned by Bayer, and this was this company bought out Monsanto, and Monsanto were the people that made all your hydrofluorocarbon light bulbs and things that are now known to. Shouldn't let a weapons company or a chemical company commandeer our food or medical supply. It just seems like a really dangerous idea. And glyphosate actually all of it comes from a mine in Idaho. It comes from a strip mine, and it's basically a type of tar that comes from the earth that's refined. It comes from some type of volcanic rock. And it's refined into the poison that it is, and it's extremely efficient at killing things. But there's and no one knows much about this, but it's in a town. This mine's in a town of like 3,000 people.
Hold on. We've had these discussions before too. Is it up there with Diet Coke? Like we still don't know. Like we've discovered it. Still don't know what 50 or 60 years of Diet Coke does. Like is this? Hold on. Is this you've discovered? But I agree with you. Like we still don't. But would you say it's similar for glyphosate? Do we still not know what 50 or 60 years of that does with a human?
No, we don't. Glyphosate, it's in everything. You can't avoid it unless you stop eating grains. But the problem is that grains are in factories with food that are not grains, so you're still going to get residue in your body. So, like there is, I forget. Anyway, years ago it was a university study, but there were 7 out of 10 people pissed hot for glyphosate in that study.
Hold on, let me look this up.
It was a really broad study.
Yeah, I'm gonna look this up. Hold on, stop.
So 7 out of 10 people, 7 out of 10 people in this country have glyphosate in their urine. I mean, that's concerning because that means they're getting way above whatever the threshold the EPA considers acceptable is. Whatever that threshold is, people to have a measurable amount of it in your urine or in your bloodstream means you're eating more than probably a honey oat bar, once a week.
Whoa. Okay,
yeah,
here.
I mean, it's. I guess the biggest thing about glyphosate is just I think there was 300 million tons of liquid glyphosate used in North America within one calendar. I forget which calendar year in early 2020s, but. I could have written a small book about glyphosate. I really should have.
No, I found it here. I found one here. So glyphosate found in more than 80% of U.S. urine samples.
It's just not. What that means is that whatever the EPA. I don't know what the
EPA. The detectable amount, but it is controversial because it has been linked to cancer, specifically non-Hodgkin's lymphoma, which is the world's most widely used herbicide and active ingredient in Bayer's Roundup weed killer. Yep. And then in the U.S. Its use has exploded by a factor of 200 since Monsanto first introduced Roundup in 1974. So what? I think Diet Coke came out in like 1980, 1981. So this is older than that. We'll know more about this. We'll know more. I drink Diet Coke off and on. So yeah, no, I get it. But no, it is true. But that was I think that was a very valid point you made to me, even when we were talking just, about being and about the way that research is, even prior to this. And this was years ago when you had declared that to me. And it was one of the mind-boggling thoughts that even today I'll take with me for the next until we hit 50 years. But it seems we'll know more about glyphosate than we will before Diet Coke. But only by a couple years, folks. So don't just hang out another 5 or 6 more years, and you'll figure it out. But wow, okay, here, what is it? Since that date, it was 2017. You were correct. 2017 study by the University of California, San Diego. Correct. So it was in results to. There was new data that showed how the chemical had infiltrated the bodies of U.S. residents, especially since 1994's introduction of Roundup Ready genetically modified crops that can.
Yes, the GMO crops.
Yep, that can tolerate the herbicide. And then they did the follow-up there in 2017. Since then, Roundup use factor increased by since that. So according to 2017, so since 94, it went up by 15. Then the prevalence of glyphosate in human urine increased by, oh my gosh, ready for this? So when it increased by the factor of 15, the prevalence of glyphosate in human urine increased around 500%. At least for 100 people in Southern California, test 3-year period.
The government knows all about glyphosate, dude. All about it. But, I mean, it's basically they have their leaders working for the private side of.
Oh, hold on. Wait. Here, let me add this in. And then glyphosate was listed as a probable, keyword here, everybody, probable human carcinogen by the World Health Organization, internationally, by the Agency for Research on Cancer in 2015. Okay, I didn't want to interrupt you there. I just wanted to make sure I included that. Yeah.
No, dude. If you get a chance, the International Agency for the Research of Cancer, they're not in the United States. They're not bought by the federal government.
Right.
They're their own
third party. Third party.
They're not biased. They're independent. They're not beholden to federal money. Any group of people that are using federal money, I would ask a lot of questions before I bought it as hook, line, and sinker. But that's me.
Wow. Look what you're putting in your body. I was looking up to the provisional 6. Let me see it here. For California, I believe it's provisional 6.7 or provisional 6.5. The one that's like stamped on everything in ethnic food stores, and the ingredients that it stamped for. And I was wondering why it was on all products. Literally, I think I picked up a container of hot sauce, and I was like, what is in this hot sauce? I looked at the ingredients, and it was something better than you'd see at like a Walmart. It had like 45% chilies and then like under 20% vinegar, and I was like, you buy anything in the United States, it's majority vinegar. Like, why are you slapping this like terrible warning on this great hot sauce? Like, what are you doing? Like, and I guess it's easier for them to pay the fine and put the stamp on there than it is to literally ship their that came over from Thailand or the Philippines, right? But they still had to come through California first, right? First state in the United States it comes into by port because of its geography, so they have to be in accordance. And it almost as if California, in my opinion, is barring innovation for business by including this. But it does include the list. Again, I'm not here to berate it. I'm here to talk about it. Of over 900 ingredients. So if over the 900 ingredients are found, that's why that stamp goes on there. And it could be lead, cadmium. Those are just of the 900.
Fuck.
Yeah.
Pardon my French, but
no.
Recording.
Why aren't these areas that we already talk about in health class back in middle school? You're correct. Your response with that word is in shock. You're in shock. I agree with you. The integrity is something to talk about.
See, Brett, this is why people like me, this is why I'm not upset with Robert Kennedy, because the way my perspective is, how do you think America, how much worse do you think it can get? I mean, we're being lied to about what's in our food, what's in our water. We're being lied to about really how to eat and what the proper way to eat is. Mm-hmm. I mean,
and now hold on, and now we have the government, who usually is, in my opinion, a bully at times, telling us, we're here for you, we want to help you, we're here to help. And it's like,
right.
Usually in history, when the government says they're there to help, people get and ask questions, they wonder. But at the same time, too, it is still a problem. So we're at this paradoxical area where it's who do you trust? Where's the integrity of the system prior, and why is it now a thing to talk about? So it's the only area, and you can't let that distract from there being action either, because the action is still important too. So I think they're all still things to talk about. As okay, let's talk about the state of things, which what I would say is that, right? Of why wasn't this talked about before? Why is this a priority now, right? And then what it is we're going to do about it and the actions about it, and have them happen at the same time. Set up a system.
Right.
And look at that. And honestly, other countries, like you've even declared, have been having these systems for quite a bit of time. Look at their life expectancy of their people. And if we're usually making more data-driven decisions here, and our governments and everything else are, is that really a data-driven decision? You're up to something.
No.
Don't stop. Don't stop.
It's a financially driven decision.
Yeah. And the interest, right? There's interest and then there's disinterest. And there's what? Usually the ends and the means. And usually, and at the end of all of it, there's the cleanup. And usually comes if there is things that need cleaned up or integrity that needs to be redeclared. Some people are just there for the start of the parade, or just there for the end of the parade. They're not there for the intermediate, and I still feel like that's the juice. That's where things happen in any event, whether it's healthcare, whether it's travel, whether it's politics, any of them, is being in that overall intermediate of the area. And they all have areas of measure. We live life in measure as humans, whether it's milliliters, days, nanoseconds. But usually there's a beginning, a middle, and an end is an area of measure too, right? Of a story. There's usually those. And same thing with that. And to see that hopefully in the end we find out here the way that things are, and we can truly make a difference as to where it is. Who have the funds to carry out said That's not what that says. That's not what that says. We who are supported by a majority of corporations, both on domestic and international. That's not what that says. It just says we the people. That's what it says.
Right.
And believe it or not,
we are the people.
That's it. Yep. And we're the media now too. We're faster than the media. By the time
like that. We are the media.
We are.
Yes.
We're the media too. Like, we are faster than, honestly, in my opinion, than the previous generations. They'll still get up every day at 7 o'clock, as it did turn. They'll still get up at 7 o'clock, go to their trusted news station, and still watch it whatever way it is. And it'll probably be morbid, things that they probably don't want to have covered. And then there's some happy story at the end, and they say, great, see you tomorrow. And now you have somebody our age that 2 a.m. goes on. Oh, shoot, some big news station just tweeted about this that I follow. Oh, okay. That's not being covered. Where is that from? There's a video of Trump or the POTUS or whoever, the prime minister of wherever, at 3 a.m. having this speech, and now we can talk about it. And 7 a.m. headlines haven't even hit yet, and I know this? Like, what's going on here? What's going on? So, yeah, no, we are the media. And all it takes is a little update and a post like it is even I've seen you do and I do myself, and people are looking at it, and the updates are there. I mean, even on a side note here, I would touch upon it a little bit, is even in the crypto realm is where now we're at a huge dip and everybody's freaking out, but it's also like potentialities for onboarding where people can see this is how the system works. It can do that. It can truly take a turn.
Mm-hmm.
All right, so you're not impressed with healthcare?
Not in many ways. No, there's a lot of room for improvement, especially the insurance companies. That's really been what's kind of on my mind lately. Is
right.
As somebody who works in this, how is it that I can't even afford to get care that I might need myself? It just seems kind of crazy, and there's more people trying to block care than there are trying to give care. I mean, basically, there's more chiefs and not enough Indians, so if you don't have enough Indians, the people giving you care, then the care becomes more of a premium thing, and, the chiefs can charge more for it if they, desire to do that. And I don't know. I think that there has to be, you basically have to go in and break up these, what are really monopolies. In the pharmaceutical industry, you have to, stop allowing people to work for the FDA and then go work and to go work for Pfizer. I forget the name of the gentleman, but one of the directors of the FDA, he just quit the FDA and is now working for Pfizer. So like things like that have to stop, because it's a clear conflict of interest when you have the agencies that the government is supposed to be laying down the law for. When you have people working for both sides, you can't say that there's a watcher watching the watchman, so to speak, if you know what I mean.
Yeah.
It used to would have been that you would have picked, either work for the state or for one of these companies for your career, and you would have picked a side. But these people are going back and forth between one side and the next, and it basically what it does is for especially like the regulatory industry, I think that creates a horrible reputation for the regulatory industry, because it's clear that the regulatory industry is, I
think you said it best. I think you said it best already. It's a conflict of interest, and it's viewable by we the people, and we see the integrity of it, and we know what's happened in the past when things of similar cases have occurred. And why should we treat this any differently? And I feel like you're up to something. We shouldn't. We should take action. We should call it what it is. We're the establishment now. We're the ones that literally can make change. We're the people that are putting people in office. We're the people, and if people are like, oh, well, why us? Why? Well, you put them there. You allow it. Whoever they are, whatever state they're in, whatever title they have, at least in the United States. I can't speak for the rest of the world now, but for the United States, that's what we're told, is that we are the ones that were put in there. We're the ones that allow that. And to see that even healthcare professionals want a real difference, that's speaking volumes. And for anybody, whether you're a health professional or not listening to this episode, take that on. Take that with you. Share that with your peers. That's literally what we are in any way, shape, or form now at this time too, just in a different location. And see,
the name of the doctor who used to work for
who is it?
FDA. Her name is Patrizia Cavazzoni. Its last name is Cavazzoni, but she quit just before Trump returned to office. But
and then went to Pfizer.
One example of so many. Like you like with the EPA, for example, part of, I think, a lot of things like glyphosate. I mean, some people, I guess you might say that falls more under the FDA's jurisdiction than the EPA's jurisdiction. And I think that in some of these cases involving human health, I think that there's an overlap. I think the EPA and the FDA should probably be communicating. I think the FDA is what largely regulates glyphosate, the Food and Drug Administration. I don't know that the
EPA, EPA,
I don't know that they have much say in it. I think they've released statements on it saying that they're okay with it, at least as of like 3 or 4 years ago. But I don't know. I would just like to see the root cause of a lot of these chronic diseases looked at, and that's why RFK didn't scare me, because I felt like the guy, he's taking over, the sickest country in the world. I mean, it's not like it's going to get. I mean, how much worse could it get?
And a recreated heroin addict. I mean, like I have no other area. Like if we can't literally be a nation, the people who have been at their weakest, I guess you could say, and be able to build up in that area of the process, what better example? And I'm not here to patronize RFK, but at the same time too, I'm glad that's an area of disagreement, because it's an area of conversation, and it's someone who we know has family roots to be able to hopefully make a difference here. And it shouldn't have
honestly,
to.
Brad, I don't want to get too off topic.
No.
I'm not.
Nothing wrong here.
I like what the Kennedys themselves stood for in the 1960s. Like, they were Democrats. That's a whole. The party today is something completely else entirely.
Yeah.
I really like what they stood for. Working class people. Like, they had physical fitness was really a big thing back in the 60s. Like,
correct.
Certain aspects, the classically liberal ideas. I mean, there was a time that was, welcome in the Democratic Party. But I mean, I without getting too political, I just, it's things have really changed, and I think that that's just the nature of anything, not just politics. But
you see promise, though.
I
see
think a
promise.
lot of people just want to know, because so many people still do work. I think a lot of people want to know, who's out for the working person, but I say that as a working person, so of course maybe that's a little bit on the bias side, but I'm still a little shocked Trump won. To be honest, I just didn't think that. I don't know. I don't think he's going to do much for healthcare, but I'm kind of shocked that he won. I didn't think that. I don't know. I just didn't see it happening myself. But.
Right, and I'd love to have you back too, to hear whatever the discoveries we have too. We haven't even reached 100 days yet, so it's amazing to see. And I know. Yeah. Well, some Americans have that area of measure, some don't. They look at that as to a change in power. Or a change in distributions of power, and not just one power either, and for anybody else out there that's declaring anybody a king, this is the USA. We have not ever had a king, and according to legislation, we're not to have a king. So if for some reason you're lost in any of that, please reread the official documents, which came out, I believe they were dated first starting in 1776. Wow. Tom, this has been an episode for definitely another return here, but truly one that people can think about moving forward and take with them and share amongst themselves and stay empowered from it. I didn't know if you had a quote or something you'd like to declare here to take us out, and go ahead and I'd call this another successful episode of Empower.
Yeah, I have a Richard Bach quote I like. It's from the book Illusions, which one of my top 2 or 3 favorite books he wrote, but the quote is, "Your friends will know you better in the first minute you meet than your acquaintances will know you in 1,000 years." And I say that because this is my 5th time on the podcast, and I consider you a friend.
Wow. I love that. And I consider you a friend too, Tom. Thank you for being here. I look forward to more. And folks, this has been another successful episode, even from our first guest way back too as well. We've had the journey, the distinction there. Not every guest has to have that, but you have, out of bravery, come from being John Smith to being Tom RN out of Colorado.
Honestly, I hope to be on here again.
I'm thankful.
I don't have a whole lot to say. I'm working on a book. Once my book is finished, I would like to get on here and discuss more.
Oh my gosh, yeah.
It's going to be a medical, sort of a medical angle on weed, but I'm not. It's a constant work in progress. And to be honest with you, I spend a lot of time on social media when I could be writing, but it's easier to be on social media for me because at work, you can set that down instantly and go on to something instantaneously, a task, at work. But, with a book, I'm sitting down, I've usually had 3 or 4 other books that I'm referencing, and it takes a lot of focus and concentration versus just scrolling YouTube or scrolling Google, what have you. But I've even got a lot of resources now actually off the internet too. So it's a book that's completely backed up by authors way smarter than me. So I really want to get it. I really do want to get it put out at some point. And when I do get it on Amazon, I self-publish it for Amazon.
Yeah. Would love to drop it.
I would like to talk,
come on here and celebrate the drop and talk about it and what's finally now made available at 24/7. Someone can have on their bookshelf and they can say RN Tom Bodner or whatever name you pick. And then in the back or at the front, it can have a Richard Bach quote. I dig it. I love it. Well, thank you very much for this. We appreciate it. And we look forward to another episode coming up here, and we don't know when. Yeah, I know. We did this drop here, and you're going to have to figure it out. It may be the following week, it may not, so that's for the own area of discovery and the own true area of excitement. And I don't think it's that far from life. So I think life has those areas of that what we still know we know, we don't know, we don't know, we don't know. And if we know that, we know a lot. So much love all the way here from Ohio to you and Colorado, and you also, folks, to all listeners out there. And bye for now. Stay empowered.